Good morning. This is my in-service for procedure versus diagnosis. Sorry for the glare, and hope you can see my screen, but I'll send these slides to you. What we have is, hold on, what the issues are. There's two issues involving patient access staff. One is confusion between procedure and diagnosis. The other is incorrect spelling of medical terms. So let's clarify the first issue, which is what is procedure versus what is a diagnosis. A procedure is defined as a single separate systematic process upon or within the body that can be complete in itself, normally performed by a physician, dentist, other licensed practitioner, can be performed with or without instrumentation. I'll let you read the rest of that, but some examples might include cholecystectomy, coronary artery bypass, grafting, or abdominoplasty. And a diagnosis is defined as a word or phrase used by a physician to identify a disease from which an individual suffers or a condition for which the patient needs, seeks, or receives medical care. And some examples of these might include acute cholecystitis, atherosclerotic heart disease, or excessive skin and subcutaneous tissue. You can see where I'm going with this. So examples of putting these diagnoses with procedures: patient 1, Jane Doe, is being admitted for a cholecystectomy, which is the procedure, due to acute cholecystitis, which is the diagnosis. Patient 2 is John Smith, admitted for atherosclerotic heart disease, which will be your diagnosis, and will be having coronary artery bypass graft, which is your procedure. And patient 3, Mary Jones, is being admitted to undergo abdominoplasty, which is going to be your procedure, for excessive skin and subcutaneous tissue, which is your diagnosis. So what happens when we mix these up? If you enter a diagnosis as a procedure, vice versa, one thing that can happen when the records get to analysis and coding, it leads to unnecessary work for them to go back and correct these mistakes. The record can be viewed, if they're left incorrect, can be viewed by clinical staff and cause patient care confusion, delay in their proper care. Should it get submitted as a claim, on the claim as incorrect, can be denied, it can be sent back, will be denied. It needs to be corrected once it's sent back, resubmitted, which delays the reimbursement to your organization. Next subject is spelling. Spelling counts, and why is this important? So, importance of accurate spelling in a medical record. I'll let you read some of that, but a wide spectrum of data is collected in healthcare and must be collected accurately, completely, and consistently. Data integrity is of extreme importance because it is used to identify and track patients as they move from one level of care to another. Data are also used to verify the identity of an individual to ensure that the correct patient is receiving the appropriate care and to support billing. Part of the accurate, complete, and consistent is correct spelling, and this applies not just to medical records, but not just to medical terminology, but anything you put in the medical record. But medical terminology is of extreme importance. So what are we going to do to correct this problem? First, we'll have the in-service with the patient access staff. Next, we'll have a training session to go over, make sure everybody understands everything. We will evaluate 2 weeks after the training. We will review 10 records completed by the patient access staff to evaluate the effectiveness of this training. And our acceptability measure will be 1 out of the 10 records reviewed. Out of the 10, there should be no more than 1 record with either a procedure, diagnosis error, or a misspelling. We will go over these. If there's an error, we'll reevaluate in another 2 weeks after a discussion with the patient access staff member. And after the additional 2 weeks, there will be consequences if there are still continued errors. The consequences, these are the final responsibility of the administration, but they may include any to all the following: verbal warning, written warning, suspension, and termination, possibly. And there are my references. So I hope you've enjoyed my presentation. Thank you.